Members, when we contract for healthcare, we do it in the dark. Employers don't know how much they should really be paying for insurance. Healthcare providers don't know what the most cost-effective treatment methodologies are. Consumers have no idea what prices are, so nobody has the information they need to deliver or have delivered to them cost-effective, quality healthcare. Also, we have no idea why healthcare costs more in one place than in another within Colorado. And what we need to get an idea of what's going on in healthcare delivery is a complete picture of each person's experience with the healthcare system, kept completely private, but when aggregated together, forming a hugely informative view of who's paying how much, for what, how it's turning out for them, whether their treatment is efficient, whether it's effective, or whether it is unduly expensive. We'll be able to identify and learn from the practices that work and steer away from the practices that don't. And we'll get all this valuable data, members, simply by collecting healthcare claims paid by all payers, insurers, Medicare, Medicaid, pharmacy benefit managers, the lot. Now, once we have a picture of what's going on, we can make policy decisions based on fact, not theory. We can set realistic fact-based standards for improvement of the system, really figure out which pilot programs are working and which are a bust, and for the first time, give information over the internet to individuals, patients, and businesses in the form they need it to make informed, market-savvy healthcare purchasing decisions. How do we do it? If the bill passes and no referendum petition is filed, then by October the 13th, the Executive Director of Healthcare Policy and Financing will have appointed an advisory committee with all the stakeholders at the table, including privacy experts, providers of all types, insurers, consumer groups, rural representatives, and even a couple of legislators. The advisory committee will work away at recommendations to the administrator, also appointed by the executive director of HCPF, as to how to structure and oversee the database collection process. And by the beginning of 2012, if we have sufficient money from gifts, grants, and donations, which is estimated to be about $1 million, if we have that money, we move into the implementation stage. If we don't have enough money, the process automatically dies. But we believe that won't happen. But we'll actually put the database into operation no later, and this is in the statute, or in the bill, no later than January the 1st, 2013. The executive director will make the data available not only to the public, but to state agencies and private research operations, consistent always with privacy laws, both state and federal. Now, as we have reached out, members, into the community, we have heard support from business leaders, consumers, payers, and providers. HB 1330 is an important and specific recommendation from the 208 Commission. In fact, Bill Lindsay, the 208 Commission chair, has lent his support for this legislation. Members, we cannot manage what we cannot measure. 7 other states, including Utah, Kansas, Maryland, Massachusetts, Vermont, New Hampshire, and Maine. 7 states have implemented a statewide all-payer claims database, and 3 more, Tennessee, Minnesota, and Oregon, are currently in the process of doing so. Supporters of this very important legislation, members, include CCHI, Colorado Behavioral Health Care Council, Colorado Center on Law Policy, representing Colorado business, there is Colorado Concern, the Colorado Health Foundation is for it, and the Colorado Hospital Association is for this bill. So is the Colorado Medical Society and the Rocky Mountain Health Plan, among others. And last, but very much not least, the United Healthcare organization is for this. So there's a lot of consensus, and it's time for Colorado to build on that consensus and to develop the most advanced, most useful, completely private healthcare database in the USA. And I ask you to vote aye on this bill.